Hello, welcome you all to our presentation today. On behalf of our team, I would like to acknowledge that we are virtually gathering here today with most of us in Saskatoon on Treaty 6 territory and the homeland of the Métis. We pay our respect to the First Nations and Métis ancestors of this place and reaffirm our relationship with one another. Myself, Abu Hana Mustafa Kamal, a second-year MA student in the Department of Sociology, University of Saskatchewan. The title of our presentation is Conducting Patient-Oriented Research in a Forensic Psychiatric Facility, a case study of patient involvement. And most members of our team will be presenting today.
Thanks, Kamal. Hi, I'm Colleen Dell, and I'm a co-lead on this project. And I'm a professor and a research chair in One Health and Wellness at the University of Saskatchewan. And what I'm going to just do today is introduce the focus of our research, of our presentation. And we're going to introduce POUR and complementary approaches to POUR. We're going to review the POUR level engagement tool that is developed by the Saskatchewan Centre for Patient-Oriented Research. We're going to identify challenges and benefits of applying POUR in a mental health setting. We're going to present our team's experiences with POUR as a case study, and we're going to focus our application of the POUR level engagement tool at the Regional Psychiatric Center. The research questions supported by our patient and advisors and addressed with RPC patients and facility staff was, what topics do you think we need to know more about to benefit patients at RPC? And we're going to suggest recommendations on how to meaningfully and practically involve psychiatric patients with a mental disorder as partners in POUR when initiating a project.
Hi, I'm Sifati Sultana, and I'm working as a trainee in this project. And I'm going to tell you a little bit about the patient-oriented research approach. So patient-oriented research actually focuses on the patient in the context of the whole person and has been defined as a continuum of research that engage patient as partners, focuses on patient-identified priorities, and improve patient outcomes. So there are some common phrases which associated with patient-oriented research. For example, nothing about us without us, and one size doesn't fit all. And the special features of patient-oriented research approach is that in this approach, patients are given the opportunity to act as equal partners in determining research priorities, developing research questions, deciding on methodology, and participating in data collection, analysis, and dissemination of findings. So there are some complementary approaches complementary approaches to patient-oriented research, including participatory action research and community-based research. Basically, participatory action research as a paradigm that focuses on conducting research with people who are concerned about or affected by an issue as partners taking action to make change and reflecting on the change process. And a key goal of participatory action research is to impact practical change through action. On the other hand, community-based research is a collaborative approach which involves community partners throughout the research process, from determining the research question to analysis and dissemination. So participatory action research and community-based research predate and likely influence the development of patient-oriented research. So while participatory action research and community-based research are utilized in various contexts, including healthcare settings, patient-oriented research focuses exclusively on improving health and healthcare systems.
Over to you, Todd.
Hi, my name is Todd, and I bring the lived experience of the incarceration to our team. The POUR level of engagement tool was developed by the Saskatchewan Centre for the Patient-Oriented Research. This tool helps to determine the extent to which the project is patient-oriented. The POUR-led tool has 5 criteria of engagement, and each is scored from 1 low engagement to 5 high engagement for a maximum total of 25. The criteria, as you can see on the screen, are number 1, patients and partners, 2, patient identified priorities, 3, outcomes important to patients, 4, team is multidisciplinary, and 5, aims to integrate knowledge into the practice. When applying Portlet tool to a POR project, the goal is not to achieve the highest component score of 5 for every criteria, but rather to work through the levels of engagement with patients to identify the most suitable levels for a given project.
Thanks, Todd. My name is Maria Cruz, and I'm a research assistant on this project. I'm a master's student in sociology at the University of Saskatchewan, and I also am the knowledge translation and capacity development specialist at the Saskatchewan Centre for Patient-Oriented Research. So it's well documented that research, as well as clinical and forensic practices within with Indigenous patients and communities have been harmful and exploitative. As such, scholars have cautioned against using only the Portlet for research projects that focus on Indigenous community engagement. So in response, the Saskatchewan Centre for Patient-Oriented Research recently developed it's called the IRLET, which stands for the Indigenous Research Level of Engagement Tool. So the IRLET measures the degree to which a project meets core criteria in the context of Indigenous communities. So in this tool, there are 4 component areas: partnership with Indigenous stakeholders, knowledge into practice, strengths-based approach, and Indigenous knowledges or ways of knowing. So similar to the Portlet, the IRLET is scored on a scale of 1 to 5, and both of the tools can be used for one project. But in contrast to the Portlet, a high score on the IRLET is ideal, as it represents a higher engagement with Indigenous communities and stakeholders. But it also should be ensured that Indigenous groups are comfortable with the level of engagement that is eventually achieved. So for our project specifically, we didn't apply the IRLET. We started this project before the IRLET was developed, but we did notice that there is overlap between the IRLET's engagement criteria as well as our processes. So once we get back in person at RPC and we can engage more fully with patients, we do plan on applying the IRLET there.
Thank you, Maria. And my name is Mansfield Mela. I'm a forensic psychiatrist and a co-lead on this project. I just want to talk to you about some of the challenges, the paradoxes, and the benefits of a patient-oriented research in the context of forensic mental health. The background is that this research was carried out at the Regional Psychiatric Center, which is a multi-level secure facility for assessment and treatment of individuals with a mental disorder under the Correctional Services of Canada. It is a place where a lot of individuals from the different penitentiaries come in to receive treatment, and so they are called patients. What is interesting is that we desired to focus our treatment of engaging them in determining the research question. Unfortunately, this environment is highly populated by Indigenous individuals to the point whereby the correctional investigator has actually called the Correctional Services of Canada to try and limit this indigenization of the correctional service. We do have these challenges of carrying out patient-oriented research, but there are benefits. We recognize that if you engage the patients, you're likely to adopt a partnership approach, share ownership and decision making together, allow the individuals to lead the research team, and provide skills and training that can be beneficial on both sides, and also move the help of knowledge translation in a way that will benefit not only the patient, but society at large when they reintegrate in the community.
Hi, I'm Nicole Camacho, and I am a graduate student in the clinical psychology program at the University of Calgary. So now I am going to talk about the materials and methods used for this research project. So patient-oriented research shares similarities with a case study in that both are approaches and not methods. A case study is an in-depth exploration from multiple perspectives of the complexity and uniqueness of a particular project, policy, institution, program, or system in a real life. So for our case studies, our case was initiated in March 2018 with the U.S. Associate Vice President of Research visiting RPC to explore the potential for research activities. And after that, administrative institutional discussions took place. A year later, RPC research groups and individuals met to discuss the potential for a participant-oriented research project at RPC. Our group drew upon an existing relationship with the positive support and St. John Ambulance visiting RPC therapy dog programs. One former RPC patient and one former prisoner that completed a therapy dog program were recruited to our team as patient advisors. Both therapy dog programs were led by a member of our team. Our two patient advisors were interviewed and asked to provide insight on advisory committee researcher characteristics, advisory committee development process, advisory committee meetings regarding the format and the process as well, and how to undertake the research project process, research topics to consider, also expected outcomes of research with RPC patients, and of course, indigenous engagement. The team then developed a questionnaire to survey all RPC patients for their thoughts on the most pressing need they have that should be researched. Next, a questionnaire to survey all RPC staff was developed and also distributed. So the data was analyzed and a total of 12 themes were developed, with the most prominent being the need for attention to reintegration. Two additional patient advisors were then recruited from within RPC, so past RPC therapy dog program participants, and were interviewed at separate times to review the themes and provide their insight on the 6 questions as of the other 2 patient advisors. The themes were presented to RPC's warden and other administrative staff and Correctional Service Canada regional headquarters for feedback. So throughout connection with the Canadian Families and Corrections Network, an organization that works with families, children, and friends of incarcerated individuals, was attempted and also is ongoing. So our teams originally planned to hold world cafes, integrating the therapy dogs for data collection, uptake, and reciprocity. This did not take place because of COVID-19. They will still take place in the future. An ethics exemption was secured from the USA's Research Ethics Board because our project was program research development. The research branch at CSC National Headquarters was consulted with and also offered support for this non-research activity. Similarly, RPCs were then offered their support as well.
Sorry everyone about that. I had a problem finding my mute button. as I'm sure we can all relate to in this COVID times. So hi, I'm Holly. I'm a Banting postdoctoral fellow in the Department of Sociology at the University of Saskatchewan, supervised by Dr. Dell, and I'm a team member on this project. So I'm going to talk about our application of the PORLET during this phase of the project. So when we look at the criteria, patients are partners. So here we achieve level 5 when you take into account institution-related restrictions. Our team attempted to inform, consult, collaborate with, and empower the patient advisors throughout the project processes, but their incarceration and other responsibilities were barriers. When we move on to the patient identified priority, when we look at that, we achieved level 4. Our project is committed to having patients at RPC identify research priorities in collaboration with our team and with the guidance of our patient advisors. Our patient advisors supported the distribution of a magazine or comic with a questionnaire to engage RPC patients so that we could learn about what questions they think are most pressing and what the needs are. When we look at the criteria of outcomes important to patients, here we also achieved level 4. Patient advisors collaborated on this project to identify outcomes that are important to them. And we've had limited but ongoing engagement with other stakeholders. And in the future, we're going to work on supporting patient advisors' leadership more. When we look at the criteria of whether the team is multidisciplinary, here we really achieve level 5. Our project team is really multidisciplinary, with a lot of diverse stakeholders involved. So this is obvious benefits of ensuring a well-rounded approach to the project processes, although it can present some challenges with communication since we're all coming from different disciplines and different perspectives and lived experiences. When we look at the criteria aims to integrate knowledge into practice, we're aiming for level 5, but this is something we're still in the process of. Knowledge translation is something that's ongoing, so whether we achieve this is to be determined. So to date, we have involved patient advisors and collaborated with them on knowledge translation, such as this presentation. And we're going to expand our patient advisory group to move forward with this aim and to really focus on supporting them to work on knowledge translation priorities and strategies. So thank you. That's just a quick look at how we utilize PORLET within this work.
Hi there, I'm Lindsay Williamson. So based on our experiences with this POR project, we have a number of suggested directions for others to take who might be interested in similar research. So first, when engaging forensic patients as partners, particularly when you're working with individuals with mental health disorders, you need to meet them in terms of their context, ability, language, and also try to remove any relationship barriers such as titles. We also believe leading with integrity as well as staying engaged and including everyone in each step in all meetings can also help build trust with patients. Transparency is also key, so making sure that you're documenting and sharing everything. We also believe that capitalizing on pre-established relationships can be really essential. So in our case, relying on our relationships through the Positive Support Therapy Dog program was really a huge asset. Number 2, when you're identifying, the patient priorities, this really requires that patients become leaders, which means that you need to give patients opportunities to build confidence, have agency, make decisions, and lead conversations, all of which are pretty counter to the forensic mental health environment. Number 3, prioritizing outcomes that are important to the patients really requires curiosity, creative engagement tools, considering multiple contexts and experiences, and also finding a fair method for determining a course of action. Number 4, forming a multidisciplinary team we believe is beneficial in that a wider variety of perspectives and skill sets can be relied upon. We think this can also help with creativity, problem solving, and networking. Team composition, we believe, should also reflect the patient demographics. So if you have a patient group that has a high proportion of Indigenous patients, then elders, knowledge keepers, Indigenous decision makers, and Indigenous patients should be involved. And finally, integrating knowledge into practice, again, requires creativity. So this might mean adopting arts-based methods, as well as consulting with knowledge translation experts and the patients themselves.
And just to end with Kamal.
So our team's overall conclusion is that forensic psychiatric patients can provide insightful knowledge based on their lived experiences of mental illness to improve the prison healthcare system and practices. We are learning each day. We are involved in this evolving field, and our learning curve should be steep as soon as we are allowed back into the facility and engage in person. That said, attempting this project during COVID has highlighted for us key areas for improvement. Thank you.